We both know that it's wrong, but it's much too strong to let it go now. We meet every day at the same cafe, 6:30, and no one knows she'll be there. Holding hands and making all kinds of plans while the jukebox plays our favorite song. Me and Mrs. Jones, we've got a thing going on. We both know that it's wrong, but it's much too strong to let it go now. We've got to be extra careful, hey, that we don't build our hopes up too high. She's got her own obligations, and so do I. Me and Mrs. Jones, we've got a thing going on. We both know that it's wrong, but it's much too strong to let it go now. No. Well, it's time for us to believe in. It had so much inside. Now she'll go her way, and sugar, I'll go my way. Tomorrow we'll meet at the same place, the same time. Me and Mrs. Jones, we got a thing going on. Yes, we do. Yes, we do. My Lady Jones, I love her, yes I do, y'all. She, we know, they know, you know and I know. We're gonna have to talk it over, baby. Talk it over, Mrs. Jones. You're my lady. My. You're my sweet foxy thing, girl. And you know I love you. But listen, we can't meet at the same time, the same place, the same cafe. We better talk it over. you. There must be some kind of way to prove I don't doubt you. It's all in how you take it. Girl, I hope we can make it. I'm just trying to tell you, baby, I'm willing to learn how to love you, baby. I'm willing. The fact is, I love you. It ain't just spring fever, completely captivated. Girl, you made me a believer. Just praising along with you should be more than I could ask for. I'm just trying to tell you, baby, I'm willing to learn. I'm willing to learn. How to be your oh, baby. Oh, baby. Said I'm willing to learn how to work my fingers down to the bone. Oh, yes, I am. How to never, ever leave you alone. Oh, no, I won't. I'm willing. I'm willing. I'm willing.
Okay, folks, it is showtime. Well, can you believe it? It took us 3 years, but we finally made it back to the Fox Theater. But it wasn't without some serious anxiousness and worry. So before we get started with tonight's ceremony, I would like to give a big shout out to the men and women of the Visalia City Fire Department and the Visalia Police Department who worked so hard to protect and preserve our beloved Fox Theater and allowed this event to happen tonight. I think you're all aware that just about a week ago, downtown was hit with another terrible fire. Unfortunately, sadly, destroyed 3 very popular businesses here on Main Street, and the flames were really lapping at the base of the Fox Theater. So we just want to say thanks to all of them. Our thoughts and our prayers go out to all of the business owners and their families. We wish them all a very speedy recovery, and we hope to patronize them as frequently as possible when they return. So, good evening. Wow, it went dark. Now I can't see any of you. I'll assume you're all smiling and having a great time. So good evening and welcome to our Kaweah Health family and all of your families and your friends. I'd also like to extend a special welcome to the Kaweah Health board members that are here present tonight. David Francis, our board president, and his wife, Catherine. Our Vice President, Lynn Havard-Mervis, and our Secretary and Treasurer, Mike Olmos. So on behalf of the entire Kaweah Health organization, welcome to the 2022 Kaweah Health Starlight Awards ceremony, where we honor and celebrate the amazing work of some of our most outstanding employees and physicians. For those of you that don't know me, my name is Gary Herbst, and I'm the Chief Executive Officer of Kaweah Health, and tonight I'm also your Master of Ceremonies, and I will be also handing out a number of awards. Yes, thank you. It is truly an honor and a privilege and an absolute delight to actually be here in person on the stage of the Fox Theater. The last 2 years, our Starlight Awards has been conducted virtually up on the 5th floor of the Support Services building, looking into a camera for 2 hours, and it's just not the same as to be here in person and to be able to just look to your right and left and congratulate your colleagues and fellow employees. Having been with Kaweah Health now for 30 years, I am the first to admit that I am incredibly biased when it comes to Kaweah Health. Kaweah Health and the Kaweah Health family are very personal to me, and it really feels like after 30 years that it's actually become part of my DNA, and my heart swells with pride every time I see or hear of the incredible care and the compassion we deliver to our patients during some of the most anxious and frightening times of their lives. I truly believe that Kaweah Health is a special place, none like any other, made special by our more than 5,000 employees, our more than 700 physicians and advanced practice providers, and our more than 100 volunteers that exhibit every day the values and characteristics we celebrate tonight. So these past 2 years, responding to the coronavirus pandemic has certainly taken its toll on all of us and has really tested our stamina, our resiliency, our courage, and our commitment to our profession and to our community. I cannot begin to adequately express my appreciation and gratitude to all of you. You are truly heroes, and you deserve an evening that is all about you. Your selfless sacrifice, your dedication, your acts of kindness, and your heroism have been on prominent display over these last almost 2.5 years. So tonight, we will honor and celebrate nurses, physicians, residents, and our partners in care, and we will present awards in 2 categories: the Kaweah Care Excellence in Service Award and the Kaweah Care Inspirational Leadership Award. Each of our executive team members will present a Service Excellence and Inspirational Leadership Award to one or more individuals in each of those 2 categories that they selected from their various areas of responsibility. And lastly, at the end of the evening, I will present to all of you our 2022 Employee of the Year. While tonight we take time to celebrate those individuals that you all felt deserve special recognition, you should all be very proud of your collective efforts this past year as you elevated Kaweah Health to new heights of accomplishment and performance. During this past year, Kaweah Health was named one of the 250 best hospitals in the nation for the 4th year in a row, and among the top 5% of the United States' 5,000 hospitals for excellence in clinical care. For the 5th year in a row, we were named one of the 50 best hospitals for open heart surgery among the 1,200 U.S. hospitals that perform open heart surgery. And for the 2nd year in a row, we were named one of America's top 100 hospitals in the care of pulmonary and critical care patients. And all in all, Kaweah Health received more awards and recognitions from health grades than any other hospital in the San Joaquin Valley. And lastly, just hot off the press, in fact, just released this week by a company called the Leapfrog Group, which is a highly recognized advocate in the country for hospital safety and transparency. For the 2nd period in a row, Kaweah Health was given an A grade which is graded on the same scale that we all received in school, so an A through an F. And so through the efforts of our incredible clinicians and all of our support staff and the support of our community, you are the ones that make that possible. So thank you. So it is now my pleasure to welcome Carrie Knudsen, our Director of Post-Surgical Care, and Mary Loffer, our recently retired Director of Nursing Practice, to the stage.
Okay, thank you. Happy to be here tonight. Can't really see you out there, but I know you're there. And we're in person, so that's fabulous. So we're going to get started with the Outstanding Residents of the Year. And these Resident and Physician Awards that we'll do after the residents are nominated and voted by nurses, and the winners selected by the Nursing Professional Practice Council. These 5 residents and 5 physician winners received their awards in March when we celebrate Doctors' Day. But tonight we announce the resident and the MD of the year. I will read a brief summary of each nomination, and if you wouldn't mind holding your applause until all of the award winners have been shared. So first, we have the Outstanding Resident of the Year for their role as teacher, Richard No, DO, who is not here, but we have someone in his place, Dr. Benfi Liu. Thank you for being here. He is the perfect role model of a resident who is dedicated to patient-focused care, always available, and he showed his genuine compassionate spirit by being so attentive and involved during the discharge of an adolescent patient on pediatrics so he could make it to his high school graduation, returning to the unit multiple times to ensure he made it home in time. Next is Outstanding Resident of the Year for Professional Collaboration, Beret Guillen, MD, from Surgery. He listens carefully to the patients and their families, as well as nursing staff. He expresses compassion while caring for patients. He demonstrates a Zen-like calm that creates reassurance as collaboration occurs. He takes the time that is needed. He is very respectful of others and has earned much respect in return. Next, we have Outstanding Resident of the Year for Communication, Dr. Jacob Kerkorowitz from Surgery, who is also not able to be here tonight. He takes the time to discuss the plan of care for a procedure with the team prior to arrival, connects during the procedure and after cases to create clear goals for the patient. Nurses rave about their ability to get a hold of him. He is confident without being condescending. Next, we have Outstanding Resident of the Year for Compassionate Care, Clayton Starnes, DO, from the Emergency Department. He is a physician we have come to respect and believe in. He places the patient and their family at the center of the care he provides. Witnessing his work, you can see his heart is genuinely engaged. He is empathetic to the patient's pain. He employs compassion in the decisions he makes. And next, we have Outstanding Resident of the Year for Patient Advocacy, Amanda Corey, MD, also from Surgery. She is an exceptional patient advocate. She takes the time to discuss all the possible outcomes and interventions available, develops a plan that is best for the patient, rounds often, making a great effort to follow up on her patients, takes note of nurses' concerns, placing them at the forefront of her team to aid in the patient's recovery. And the Resident of the Year is, drum roll please, Dr. Richard No, DO, or Benfi Liu. Here for a moment. Okay, so Dr. No's full nomination reads, So he cannot be here tonight because he has a conference in New Orleans. Richard No graduated from Touro University College of Osteopathic Medicine and came to Visalia for residency in June of 2020. He is a second-year emergency medicine resident who caught the attention of the team in pediatrics while on his surgical rotation. The surgical care of one particular patient was impeccable, but it was his nature and ability to connect that captured the staff, who describe him as uplifting, motivational, and empowering. Dr. No demonstrated the delivery of quality education to a 17-year-old man with ruptured appendicitis. This patient was struggling with motivation to engage in his recovery and had an important life event to attend that he surely would have regretted missing out on. He sat down with the patient and explained to him the importance of participating with his activities of daily living and how this would lead to a faster recovery and allow him to make it home before his graduation day. Dr. No was receptive to the pediatric nurse's suggestion that the patient might listen to a male figure when they explained that he was withdrawn from his care and hadn't showered after 6 days. He is the perfect role model of a resident who is dedicated to patient-focused care. He was always available when we called, and if he said he would come to the floor, he did. Dr. No showed his genuine compassionate spirit by how he was so involved and attentive during the discharge of our 17-year-old patient so he could make it to his high school graduation on time. He returned to the unit to make sure he was discharged multiple times. So a round of applause for Dr. No, Dr. Benfi-Liu, and the rest of our amazing residents. Congratulations. Thank you. Next, we have our Outstanding Physicians of the Year. Several of them are not here tonight, but we will celebrate them nonetheless. First, we have Outstanding Physician of the Year for their role as teacher, Leland Beggs, MD, who is not here. Dr. Beggs is always ready to teach. We are fairly sure he doesn't even know how big of an impact he has had on us. He takes time explaining complex patient cases, altruistically puts himself in patients' shoes, and doesn't sugarcoat things, but gives all the options. The team has faith that resolution will be found when Dr. Beggs rounds. Outstanding Physician of the Year for Professional Collaboration, Christian Borberg, MD. He's also unable to be with us tonight. Dr. Borberg collaborates on the care his patient will receive, with active discussions that include the best interest of the patient, nursing considerations, and best practice standards. He actively listens to the nurse, faithfully engages the patient in the plan, answering questions, and easing fears. Outstanding Physician of the Year for Communication, Ryan Howard, MD. He's here. You get a round of applause. Dr. Howard has phenomenal communication skills. He is wonderful at guiding the family through difficult decisions and has exemplary skill during critical and life-changing conversations. Outstanding Physician of the Year for Compassionate Care, Michael Tadaldi, MD, also unable to be with us. Dr. Tadaldi gives respect freely to his patients and their families. He provides exemplary service, hallmarked by compassion and a willingness to provide assistance. He is described as incredible, with a positive attitude and obvious kindness. Nurses love it when he is their patient's physician because they know how well they will be taken care of. Outstanding Physician of the Year for Patient Advocacy, Christopher Bencomo, MD. Dr. Bencomo is a one-of-a-kind provider. It is his concern for the well-being of his patient that speaks most to the obvious value he places on providing quality care. His passion for his work is evident and consistently performed with meticulous detail. He is respectful to every person he encounters. It is providers like him who improve the quality of care for our patients. And the MD of the year is Dr. Ryan Howard. You're welcome. Okay. So his full nomination reads, Dr. Howard is a hospitalist and the medical director of palliative care and hospice. He started at Kaweah Health in 2018 as a hospitalist, then obtained a graduate fellowship in hospice and palliative care from UCSF in 2020. On Christmas Day, a patient was admitted to hospice just 5 short days after a metastatic cancer diagnosis. This patient was very young, with young children in the home. The patient and her spouse were struggling with balancing her remaining functionality and time with her family versus the progression of the disease. Dr. Howard was contacted for additional support and recommendations to assist with comfort and quality of life in this very delicate time. Dr. Howard spoke with family on the phone for approximately 30 minutes during this visit. He was very compassionate and caring in his approach. His empathy and understanding of what the patient and spouse were feeling was very evident. He offered options for comfort with an expressed understanding for what the family wanted. He acknowledged their feelings and validated their concerns, ultimately creating a plan that met the patient's needs. It is very appreciated by nursing staff and families that Dr. Howard shows such genuine kindness and sincere compassion while providing care to our patients as they navigate such a delicate time in their lives. Although we know he's busy and may be in the middle of a situation in the hospital, he has developed the habit of pausing a moment, mentally separating himself from his physical environment to make himself completely available for questions from a confused nurse or staff who have complex patient needs to figure out. He asks pertinent questions and thinks out loud, giving rationale for his decisions so that each interaction can become a learning opportunity. Thank you, Dr. Howard. Congratulations. Thank you for coming. Am I supposed to be taking pictures? Oh, sorry. You heard that, huh? Apologies. We're getting the flow down up here. Okay, moving along. Partner in Care Awards. The Partner in Care is someone who consistently impacts nursing in a positive way and exemplifies excellent customer service, collaboration, and teamwork. They are chosen by each unit where nursing is practiced, or some of our other departments that have unit-based councils where there might not even be a nurse present. Our Partner in Care Award winners are, from 2 North, Isabel Aspieda, CNA, 2 South, Ashley Valenciana, Huck, 3 North, Nancy Landeros, CNA, 3 South, Frida Matos, CNA, Broderick Pavilion, Cassandra Kane, Central Distribution, 4 North and Acute Hemodialysis, Sonia Fajardo, CNA, 4 South, Katie McMillan, CNA, 4 Tower, Juana Correa, Environmental Services, 3 West, Lisa Fonseca, CNA, ICU, Katrina Nieto, CNA, 5 Tower, Debbie Seeger, Huck, CVICU, Erica Fernandez, Huck and CNA, Float Pool, Taylor Suggs, CNA, Labor and Delivery, Felicia Reyna, Surgical Team Assist, Mother Baby, Taryn Krenz, Unit Secretary, NICU, Kyra Ashcraft, Clinical Pharmacist, Pediatrics, Elizabeth Lee, CNA, the Emergency Department, Roberta Sadler, ED Tech, OR, Maria Bautista, STA. CV Services, Michelle Martinez, ISS Application Analyst. ASC, PACU, and Endo, Jackie Creason, CNA. Mental Health, Megan Garcia, Mental Health Worker. TCS, Elizabeth Chavez, CNA. Rehab, Maggie Turan, CNA. Subacute, Imelda Duran, Unit Secretary and CNA. Visalia Dialysis and CAPD, Molly Saturn, RN. Hospice, Stephen Bennett, Spiritual Support Counselor. Home Health, Steve Strobel, Occupational Therapist. Private Home Care, Liliana Hermosillo, Personal Care Aide. Specialty Home Care, Kristen Gahagan, LVN. CDMC, Veronica Sandoval, MA. Care Management, Valerie Seffing, CM Secretary. Rural Health Clinic, Exeter, Edith Alvarez, Patient Access Specialist. Rural Health Clinic, Lindsay Lubetti Rios, Patient Access Specialist. Rural Health Clinic, Woodlake, Christina Denny, LVN. Rural Health Clinic, Dinuba, Perla Gonzalez, Patient Access Specialist. Rural Health Clinic, Tulare, Cecilia Barajas Quevedo, MA. Urgent Care Clinic, Court Street, Elia Luna, Clinic Business Office Lead. Urgent Care Clinic, Demarie, Trinice Cisneros, LVN. Sequoia Health and Wellness Clinic, Angelique Meja, Patient Access Specialist and MA. Wound Center, Uriza Cano, Rehab Aide. Radiology, Michelle Laura, Imaging Technologist. KDMF Gastroenterology, Oneida Pruneda, MA, and Patricia Gonzalez, MA. Round of applause for all of our partnering cares.
Good evening. My name is Dr. Douglas Blume. I'm from the radiology department, so many of you may not know who I am. I've been here about 5 years, sitting in for the more handsome and illustrious Dr. Hightower, who couldn't be here tonight. I'm here to have the honor to present the Nurse of the Year Awards for the medical staff. And this year there are, I guess, 3 of them. I'm not sure if that's normal or not, but 3. One from the emergency department, one from surgery, and one from pediatrics. The first I'd like to recognize is Candace Hatfield from the emergency department. And I have a pre-prepared statement from their nominating departments here for them, which is very nice. Candace led the department through the very difficult COVID times. She's always nice and comforting to the patients when they're screaming in her face about the wait times, hopefully not with COVID. Huge team player, has been instrumental in ensuring new nurses coming through are all trained very well. Candace is all about patient safety and can somehow move mountains to keep the ED flowing at the same time. She does this with a smile. She's easily one of the best nurses I've ever worked with in my entire career. Congratulations, Candace. Next, I'd like to recognize Edward Escobar from surgery. Edward makes Kaweah Health OR work efficiently. He juggles with often limited resources, communicates effectively with all new team members, makes the surgeons feel valued and respected. Edward is resourceful and accommodating to both patients and as well as physician needs. The end result is a smooth and efficient functioning OR. Congratulations, Edward. And the final recognition will go to Monica Reyes from Pediatrics. Monica always has a positive attitude and cares about her patients with excellence. She's helpful, compassionate, and hardworking. Monica always goes above and beyond for her patients and all patients admitted to the pediatrics floor. She is a fantastic and dedicated nurse. Congratulations, Monica. Thank you.
Hi, everybody. Good evening. My name is Dr. Lori Winston, and I am the Chief Medical Education Officer for Kaweah Health. In my departments for the past 9 years, we've had the privilege to train new physicians for our local community and generate research, and it truly takes a village. Understandably, we educate our residents on things like medical knowledge and patient care, but we also teach them interpersonal skills and professionalism. And as they progress through their training, they learn to value and respect all members of the healthcare delivery team. Through this curriculum, they gain the ability to recognize an excellent nurse, and tonight is my honor to present 6 deserving nurses with recognition for their outstanding performance at Kaweah. Each residency program voted, and I will read the text from each nomination as well. This is the very first year that the residents have requested to be able to give awards to the nurses, and I think that it speaks volumes about the team that we're building here at Kaweah. So first up, from the anesthesiology residency program, the nurse of the year is Vita Halsley from cardiac surgery. Here we go. So the residents said that Vita continuously makes us feel welcome, which is super hard in the operating room, in case you didn't know that. And she helps us to acclimate to a new environment. She is also super helpful on a daily basis. And if you've ever rotated as a medical student in the operating room, honestly, the nurses are part of the scariest part. So this is an amazing award. Thank you so much. All right. Next, from the emergency medicine residency program, the nurse of the year is Patrick Ramirez from the emergency department. Oh, you're still sitting. Okay, stand here for 1 second. Patrick consistently shows up and puts in hard work to help the ED in all areas. Prior to assuming his managerial role, Patrick was constantly helping others with difficult IVs, mentoring less experienced nurses, and generally putting out fires across the department. In my role as a resident, said the residents, Patrick has always been approachable and accessible and does his best to help patient care move forward no matter the obstacles. We are happy for him when he was selected to serve his current leadership role. Congratulations. Okay, next up. From the family medicine residency program, the nurse of the year is Jessica Haas. She's from ICCU 3 West. All right, Jessica is, according to the residents, smart and helpful, always comes to work with a shining attitude through the toughest days. She is always willing to help and teach residents and never looks down on anyone. She cares deeply for her patients and is an inspiring example of work ethic, resilience, and a determined positive attitude. Congratulations. All right, they're playing music for me. Okay. From the psychiatry residency program, the nursing award goes to Marissa Torres. I don't think Marissa's able to be here with us, But I will say that the psychiatry resident said that Marissa knows her patients so well and is always able to tell us about the events that occurred, including reasons for injectable medications or refused medications. She's a great positive attitude and makes herself approachable. She is fun to work with. Even when the unit is super acute, she puts in extra effort to encourage patients to have their meals, labs drawn, or take their meds. If I tell her a specific plan I have with a patient, she is quick to get on board and ask insightful questions. I'm always glad to see she is my patient's nurse because I know they will receive excellent and compassionate care with Marissa. Thanks for all you do. Okay. 2 more. From the General Surgery Residency Program, the Nursing Award goes to Sandra Gonzalez from 3 North. All right, the surgery residents say that Sandra is very attentive with our surgical patients and their needs. She's an excellent communicator between the nursing team and the residents. She provides guidance to junior residents. She is able to simply get things done and moving, and we very much appreciate that. All right. And from our transitional year program is 1-year internship for residents that are bound for other specialties like radiology, ophthalmology, dermatology. And so to be able to impact them in this 1 year, the nursing award goes to John Steffing from the Rapid Response Team. John always goes above and beyond for patient care. His positive attitude makes him an absolute pleasure to work with. Congratulations. All right, congratulations to the winners of these awards, and thanks for all that you do to help train our outstanding residents.
Okay, good evening. I have the privilege to present the Excellence in Nursing Leadership nominees. This award honors a leader who transforms our organization's values, beliefs, and behaviors through innovative leadership. And the nominees are Dee Vernon, Felicia Vaughn, Roberta DaCosta, Sandra Echevarria, and Andrea Hodgkins. And the winner is Andrea Hodgkins. Andrea has established expectations for the unit that create an environment of respect and teamwork. She has great intuition and insight about what the team needs and has crafted changes to her onboarding processes, preceptor assignments, and educational offerings by anticipating what her team needs. Andrea inspires and coaches her team for excellence through individualized employee rounding, expectation setting, and role modeling on the unit. She communicates concisely and often to keep her team well informed. She provides timely and very individualized annual evaluations of performance, keeping notes on employees all year to be sure to capture items that are important from both a celebratory and improvement perspective, ensuring that evaluations are meaningful. Andrea is very good at valuing her employees through shout-outs in weekly updates, monthly drawings among those who have been recognized by patients, families, or peers, emails to the staff, and acknowledgement at staff meetings. She is very approachable and wants to stay connected with her team. She frequently makes rounds out on the unit just to stay in touch with them. She was a staff nurse on the unit not that long ago, and is very professional in her interactions with patients. She's able to look at the big picture when making decisions and models a calm, cool demeanor no matter what the situation. She reaches out to both staff and public in a kind and caring way. Her work ethics are high, and she strives to always do what is best for 3 North and also for Kaweah Health as a whole. Andrea was the manager representative on the Professional Practice Council for the past 2 years, which afforded her the opportunity to interact with the shared decision-making nursing leaders and offer a leader perspective on topics discussed. She is post-pyloric certified and routinely inserts tubes for patients on the units, interacting with the primary nurse and advocating for their use and mentoring her team. She is passionate about SNA, SNI hiring as a recruitment tool and promotes the educational pursuits of 3 North team members, investing in the development of future nurses as healthcare professionals. Thank you, Andrea.
Service to society. This award honors a nurse who influences an innovative environment where strong professional practice flourishes and where our mission, vision, and values come to life and positive outcomes are achieved. They may partner with the community to improve patient outcomes and our community's health. The Service to Society nominees are Sydney Alvarado from Hospice, Janet Furtado from 4 South, and the winner is Janet Furtado. Janet is compassionate about the community we serve. She advocates for non-English speaking patients when she notices they do not understand the healthcare team. She calls interpreter services for patients, even when they are not assigned to her, to ensure they understand instructions or education being given. She is chair of the Unit-Based Council on 4 South and recently brought forward the need for education in English and Spanish for our stroke patients in an accessible venue like the Education Channel on TV. Janet recently created a fundraiser on 4 South. Money raised went towards CSET, a nonprofit organization who was seeking funds to purchase microwaves for elderly people in the community who did not have one and could not afford to buy one. By receiving a microwave, they became eligible for Meals on Wheels program to receive home-delivered meals. Through consistent communication and dedication, Janet inspired her team and raised $600, providing microwaves and meal security for 7 elderly people. She cares very deeply about our community and is always seeking ways to lend a hand up. Her next goal is to figure out how to better serve our Hispanic population with quality communication and consistent education to prevent unnecessary return or future visits. Thank you, Janet.
And next we have Advancing Practice Award. This award honors a nurse who shares their new knowledge through mentoring, education, clinical practice improvements, policy development, and innovative thinking. The nominees are Kathy Kaiser, Jean Magahis, and Cody Erickson. And the winner is Cody Erickson. Got his own little cheering section. Cody is involved in many behind-the-scenes initiatives that drive forward the quality of care we deliver at Kaweah Health. Cody starts every day by reading evidence-based literature for at least 30 minutes and then spends the remainder of his day working collaboratively to devise and implement policies and procedures that will improve the quality of care that is delivered by bedside staff. Not only does Cody work on policies and procedures independently, he sits on many committees and passionately advocates for improvements in our processes to ensure that patients receive the best possible care while here. Cody has high expectations, and he shares his knowledge with those around him to try and help staff learn and grow. As an advanced practice nurse, he shares his knowledge with his peers in a number of different ways. As an educator for the Critical Care Nurse Residency Program, interacting with staff through Gemba rounds, and demonstrating hands-on experience. He also provides educational opportunities for our residents in the GME program. Cody exercised great flexibility and wore many hats throughout the COVID pandemic. He performed nasal swabs at the testing center, supported staff on the units, and resumed bedside patient care assignments in the ICU. Throughout it all, he's remained committed to ensuring our patients receive the best care through the changes. Cody is an absolutely brilliant clinician, and his commitment to driving forward the profession of nursing is something we can all aspire to. Thank you, Cody.
Advancing New Knowledge and Innovation. This award honors a nurse who contributes to the advancement of patient care, the organization, and the profession in terms of new knowledge and innovation by applying best practice models in nursing theory and research. Our nominees are Melissa Gomez and Yuli Chen. And the winner is Yuli Chen. Yuli is described as kind, helpful, and attentive by her patients. She comes to work with a positive attitude and advocates for her patients in the moment. Yuli is a mentor on the unit and recently started precepting traveler nurses. She takes the role seriously and is engaged with each one. She takes notes to research later and provides feedback individualized to best serve the person she is training. Yuli brings evidence-based research that she has done on her own to the manager and the advanced practice nurse for their consideration. The first topic she investigated was the recommended frequency to change peripheral IVs. She also requested to be involved in committees, and based on this interest, she joined the CLABSI committee. Yuli is consistently looking for ways to challenge herself and improve nursing practice. Thank you, Yuli.
So, Clinical Nurses of the Year. These awards honor nurses who embody exemplary professional practice, including a comprehensive understanding of the role of nursing, the application of that role with patients, families, communities, and the interdisciplinary team, and the application of new knowledge and best practice. Christina Custodio, Clinical Nurse of the Year for the Medical Surgical Nursing Practice Council. Christina is involved in the 3 South CUSP team and serves as the chair for the 3 South UBC and chair for the Nursing Practice Council. She recently worked to provide food and bedding for our local SPCA and is working on a Pay It Forward project to give thanks to another unit. Her involvement in these committees demonstrates her desire to improve our work environment and patient outcomes. She's very knowledgeable in our policies and refers nurses to them when educating, which she does extremely well by taking the time to sit down and ensure understanding. Christina has been here for 20 years and still has so much passion for her career. She cares so much about the staff and the patients on the floor. She's incredibly knowledgeable and is the go-to person for any questions on the floor. She goes to other floors to start IVs, insert post-pylorics, and she helps pass medications and does patient care when she sees other nurses need help. As a charge nurse with a patient assignment, it can be hard to take time with them, but she can be found brushing their hair or holding their hands talking about their concerns. The team feels honored to work with her and look up to her and the care that she provides. The patients and staff on 3 South and Kaweah Health in general are very lucky to have her here. Thank you, Christina. And next is Esmeralda Ayan Baleche, Clinical Nurse of the Year for the Critical Care Nursing Practice Council. Esmeralda is a preceptor and team lead on 2 North. She is ICCU trained with ACLS and NIH certification. Esmeralda is an outstanding member of our team. She is warm, genuine, competent, and displays a sincerity in her concerns and compassion for patients and their loved ones. Esmeralda finds creative solutions for barriers to discharge, advocating for a safe discharge plan, and provides focused patient education. She never falters in her approach to care and has an ability to connect with our more challenging patient personalities. She makes safety a priority with each task and is proactive in addressing potential issues. She is regularly recognized by her patients for exceptional care during leader rounds. She will do whatever it takes to assure that she exceeds the needs of her patients. Esmeralda was elected the 2 North Unit-Based Council Chair this year. Since being in this position, she has shared many ideas on how to promote team spirit. Even with everyone's busy schedule, she has successfully coordinated the first 2 North bowling event for the staff and their families, and that's great. Another project she spearheaded was creating a wound supply dressing cubicle. With leadership support, the unit's par levels for wound supplies were adjusted to mirror regular use, and other supplies were added that were called for. This change affords the bedside nurse time to do a dressing change in the moment of discovery, or when it best fits into their shift. Esmeralda is the nurse that you want caring for you, or the one that you aspire to be like. She is a blessing to many. Thank you, Esmeralda. And next, Clinical Nurse of the Year for the Maternal Child Health Nursing Practice Council is Carol Christensen. Carol is a charge nurse from the Neonatal Intensive Care Unit, where the tiniest neonates are cared for, some weighing only 500 grams. She skillfully provides care at the time of delivery by placing emergency umbilical central lines. She is expert at calculating the volume of normal saline boluses, surfactant dosing, and the antibiotics that will be needed empirically. Many emergency procedures can be necessary in the care of our very low birth weight babies and also our term average size babies. She is the go-to person for guidance in setting up equipment necessary for chest tube placement, transfusing blood into an umbilical arterial line, or placing a replogal tube. Yeah. As one of the charge nurses, she responds to the pediatric and neonatal RRTs that occur in the emergency department, and she jumps into action to expedite care for these patients. It is amazing to witness. She's the chair of our NICU CUSP team. Our current project is skin injuries and integrity of the neonate. Carol, thank you for being a leader and steward of the neonates and children in our community. Congratulations. And next, our Clinical Nurse of the Year for the Post-Acute and Outpatient Nursing Practice Council, Dahlia Sanchez. Dahlia is a strong and capable charge nurse at subacute. Her colleagues describe her as amazing and professional. Dahlia remains calm and collected in any situation and has great bedside manners. She keeps our patients' best interests at the center of care we provide and advocates on their behalf. She is kind and caring towards our patients and their families, recognizing the importance of their involvement. She includes them in the plan of care. Dahlia has been providing hard work and dedication at Kaweah Health for over 20 years. Congratulations, Dahlia.
And the Clinical Licensed Vocational Nurse of the Year is a new award this year. We have 4 of them, one for each NPC. Our first award winner is Victoria Manduhano, who unfortunately is not with us because she's in school tonight working hard on her registered nurse degree. This award honors an LVN or LPT who exemplifies excellence in partnership and collaboration, working in tandem with the registered nurse to achieve safe, therapeutic, and effective care. They seek and create solutions, advocate for compassionate patient care, and display sound decision-making ability. Victoria came to BP as the first LVN in a newly created role. She quickly helped to define the role unique to the unit's needs, and then trained and oriented 3 other brand new LVNs. Victoria has been a mentor to many new LVNs at Kaweah Health, passing on her knowledge and love of the job to newly hired staff. She sets a high standard for all new LVNs. She is taking courses to apply for an RN program soon. Working full-time, she still makes time to further her education. She is always one step ahead, anticipating the needs of the patients and other nurses. Victoria is an extremely hard worker who shows up to every shift with a smile and good attitude. She goes around asking RNs and CNAs if they need any help, doing medication passes to bed baths without hesitation. She never sits still and is always looking for something to do. She is compassionate with the patients and their family members. She is respectful of everyone on the unit, and her demeanor is professional. Her team knows they can count on her and call it an honor to work with her. Congratulations to Victoria. She might see this later, and we'll get her award to her. The Clinical Licensed Vocational Nurse of the Year for Critical Care is Anissa Rivera. Anissa is an LVN in the float pool and CAPD, EKG, and wound vac certified. She is a well-rounded LVN with great clinical skills and always willing to take advantage of any new learning opportunity. She works well with the nursing team and is often sought out for her advanced skills. Anissa is the co-chair of the Float Pool UBC. She encourages other float pool employees to join UBC and has helped increase attendance by half its size. This year, she helped organize the UBC Community Salt and Light Donation Project by delivering jackets and also helped our local animal shelter with donations. Her expertise in the ED's 1 East admit zones has been critical in improving workflows. One weekend, she came in on a day off just to hunt down beds and move them into Zone 1 for patients' comfort, adding signage to keep the beds from being removed. Didn't work though, huh? Anissa works well with every department. She ensures patient needs are met. She is a strong patient advocate and collaborates with nursing to provide the best care possible. The Clinical Licensed Vocational Nurse of the Year for Maternal Child Health is Ariana Myrick. Ariana is an LVN on OB postpartum. As the unit's break nurse, she also assists the RNs to complete needed tasks for babies so they can be discharged timely. Ariana does the majority of all TCB, Hep B, PKU, and CHD testing on our babies. I actually know what that means. She shows complete autonomy with getting these tasks accomplished. The majority of the RNs do not even ask her to complete them. She just does this for our unit, while also providing our unit's lunch breaks and providing coverage for PED staffs for lunches. She is extremely efficient and does it all with a smile on her face. Ariana is outstanding in her position. She knows her scope of practice and is quick to alert the RNs if there is anything that seems off with either mom or baby. Ariana is an outstanding in her attention to care. Congratulations. The Clinical Licensed Vocational Nurse of the Year for Post-Acute and Outpatient is Alma Cruz. Alma is a lead LVN in the pediatric department at Exeter Clinic. She is well trained in all aspects of her role and expert in pediatric caths. She leads by example and assists with all providers and staff in her department. She is well respected and appreciated by the staff. Alma is always willing to help out in other departments when her expertise is needed. She assists with rolling out new workflows and is usually the first to volunteer when there is something new to learn or implement. She assists with ordering or requesting specialized medications for our pediatric patients, whether that is requesting the medication from our pharmacy or working with health plans to try to get items authorized for approval. She sticks with it until she gets what is needed. The providers in the pediatric department work closely with Alma and always have great things to say about her positive attitude and willingness to assist. Alma is great with our patients, making sure all their needs are met. Congratulations.
My name's Evelyn McIntyre. I'm the Director of Risk Management. I would like to announce, here I am. Patient safety is our #1 priority at Kaweah Health. All high-performing healthcare organizations around the United States recognize and celebrate healthcare professionals who identify and act to resolve patient safety concerns. Part of Kaweah's comprehensive patient safety program includes monthly Good Catch Awards. The 2021 Good Catch Award recipients are staff and providers who have made a significant contribution to patient safety. These awardees were nominated by their fellow coworkers for going above and beyond to keep our patients safe, and we applaud and value their dedication to our patients and community. Congratulations to all of these outstanding Good Catch Award recipients. Samuel Hernandez, HIM technician. Kelsey Ziegler, clinical pharmacist. Brianna Medina, lab tech. Delia Barajas, CNA in CVC. Sunny Adigale, therapy manager. Cecilia Franco, RN at the Mental Health Hospital. Frank Chavez, Emergency Department Technician. Michael Quintana, Pharmacy Technician. Jennifer Nicholas, charge nurse, Yvonne Maya Bucio, RN 3 West, Lauren Clark, clinical pharmacist, and Barbara Roldan, EVS aide. We thank you for your commitment to patient safety. Congratulations to the 2021 Good Catch winners. Now I would like to announce our 2022 Patient Safety Hero of the Year. Each year, our panel of patient safety experts reviews each monthly Good Catch Award recipient and scores them based on 4 criteria: scope and severity of the problem identified, the impact to Kaweah Health's patients, and the degree of action taken by the employee. It is from this evaluation that our Patient Safety Hero of the Year is selected. This year, we had a tie, and I will be recognizing 2 outstanding recipients. I am honored and proud to announce our first 2022 Hero of the Year award to Sunny Adigale. At the time of his Good Catch Award, he was a physical therapist in our medical center, but since, he has been promoted to therapy manager at Kaweah Health. In 2021, Sunny made a significant good catch, which changed the entire course of care and outcomes for an ICU patient. While working with this patient, Sunny noticed a clear liquid was dripping from the patient's nose, which can be a sign of a severe neurological condition. He spoke up and he advocated for this patient. He was interested in having that fluid tested to rule out any concerns. The initial test happened to be negative, but 3 days later, when Sunny returned to work with this same patient, he recognized that the fluid was still dripping out of the patient's nose. Sunny was still concerned, and he trusted his knowledge and his instinct and continued to advocate for this patient. Thanks to Sunny's diligence, the fluid was tested again and in a different way, and that information was brought to a specialist for further evaluation. The fluid dripping from the patient's nose happened to be spinal fluid. It was coming from the patient's spinal column, and the patient was sent for emergency brain surgery. Sunny, you are a true hero. Healthcare practitioners like you, who are willing to speak up regarding concerns, are able to help decrease errors and prevent adverse patient outcomes. When we are aware of concerns, we can work together to ensure that interventions to prevent harm to our patients are put in place. We thank you, Sunny, for being such a strong patient advocate. Congratulations. I'm equally as honored to award our second 2022 Hero of the Year award to Barbara Roldan, an environmental service aide at the medical center. In December 2021, Barbara was cleaning a patient's room. She noticed that the patient looked pale and was not very responsive. She sent the student nurse to find this patient's primary nurse, who immediately went to the patient's bedside. The patient had severely low blood pressure. A rapid response was called for the patient, and the patient was transferred to the CVICCU. Audrey, the RN working with Barbara that day, is also thankful for Barbara, who not only supports our environment of patient care, but also communicated when she saw something was wrong with this patient. The courage to speak up and express concerns regarding a patient's safety is extremely important in a fast-paced environment like a hospital setting. Barbara and all of our staff are an important extension of our clinical teams and at times may see or hear something that is concerning. In this situation, Barbara made a quick decision to express her concerns to the appropriate clinician. That's not always easy. By having the courage to speak up, she gave the patient an opportunity to get timely care that meant the difference between life and death. Barbara, thank you for keeping a close eye on our patients and going above and beyond to ensure their safety. You are a true hero. Congratulations. To both Sunny and Barbara, I also want to say you are both strong role models for patient safety. Not only did you significantly impact these specific patients' course of care and outcome, but by advocating for your patients, you model this for others at Kaweah Health, and it creates a domino effect. These are the kinds of behaviors that activate a chain reaction, the kind of chain reaction we want to recognize and celebrate. Congratulations.
All right, thank you, Evelyn, and thank you and congratulations to our Good Catch Award recipients and our Patient Safety Heroes of the Year. So before I announce our world-class Employees of the Month, I didn't think she was going to make it here tonight, but she did, and I couldn't be more delighted. Amber Rodriguez is a member of the Kaweah Health Board. Hi, Amber. It's real dark out there, but I see you waving. So we're so delighted that you're able to join us, so thank you. So it is now my honor to once again recognize our 2021 World-Class Employees of the Month. Employees of the Month are selected for providing excellent care and service, exceeding expectations, going the extra mile, and showing kindness that makes a difference. This group of 12 was chosen because they continually provide world-class service. They are Cora Rogers, Monica Bolton, Robert Pierce, Annette Padilla, Lisette Magallanes, Larissa Dodson, Jody Charas, Alice Vega, Wendy Walters, Prasanna Flores, and Maria Aguilar. And I apologize if I messed up any of those names, but you're still near and dear to us, and we thank you for everything you do. Okay, so we are now moving into the part of the program where our executive team will honor team members who went above and beyond in 2021 and excelled at service excellence and who are inspirational leaders. So we will lead off with Doug Leeper, our Chief Information Officer.
Thank you, Gary. Please welcome to the stage Brian Olszewski. Brian is an outstanding employee and teammate, and his attitude, words, and actions makes him an outstanding recipient of the Kaweah Care Excellence and Service Award. Brian is a member of the ISS Server Administration team, and as such, handles very technical and complex hardware and software projects and issues. Leveraging his extensive knowledge and experience, he gracefully maneuvers through major challenges as though they were minor inconveniences. And he always does so with a friendly, helpful demeanor and the utmost in professionalism. Brian is always willing to assist and is highly engaged and attentive. He comes across as a trusted friend trying to teach you a new shortcut to a problem that has stumped you for a very long time. Brian, thanks so much for all you do to benefit your coworkers, our patients and community, and Kaweah Health, and congratulations on receiving this award. Gotta love the music. All right, I know you do. All right, please welcome to the stage Ethan Jones. Ethan leads the ERP team in ISS and is receiving my Inspirational Leader of the Year award. Ethan has impressive expertise in the systems and processes his team is responsible for, but what really makes him stand out is how he genuinely cares for and supports his team, how he always treats people with respect, dignity, and compassion, and how he puts the needs of others before himself. Ethan is the epitome of a servant leader. In turn, his team is inspired to do great work on behalf of Kaweah Health and in support of Ethan, and they rally behind him to ensure his success and that of the entire team. The work Ethan does for his community is also inspiring. He cares about those around them and wants them to have a better life. He's also a triathlete, which as a couch potato I find amazing. And he also can perform marriages if anyone's interested. I know some of you are dressed for it out there. Ethan, congratulations on your much-deserved award. Kaweah Health is a better place because you're here.
Hi, good evening. My name is Jamie Hopper, and I am the Director of Clinical Operations at Kaweah Health Medical Group. And it is my absolute pleasure to be able to present the Excellence in Service Award for Kaweah Health Medical Group to Rosie Bautista. Rosie is phenomenal. She is dependable, efficient, and loyal. Rosie has a great professional relationship with her patients and always makes them feel welcome. Rosie had a health scare last year with one of her children, which made her be able to relate to her patients on a more personal and understanding level. Rosie also jumped in when needed during COVID and gave her weekends to Quick Care, covering as their receptionist with no hesitation. She has an eye for attention to detail for her job that does not go unnoticed by staff and Dr. Amalulu. Rosie exemplifies health is her passion, excellence is her focus, and compassion is her promise. Congratulations, Rosie. All right. Last but not least, it is my honor to present the Inspirational Leader Award for Kaweah Health Medical Group to Natalia Reyna. Natalia really is a true gem of Kaweah. She has served in the clinical coordinator role for the last few years and has literally knocked her job out of the park with over $500,000 in earnings for the clinic. During the pandemic of COVID, the clinic had to make many changes, not all easy. Natalia literally rolled up her sleeves and dove right into the chaos without any hesitation. She knew the needs of the patient, staff, physician, and prioritized her duties to align with what needed to be done. She spearheaded multiple projects over the coast of this past year, including centralization and decentralization of our screeners, COVID vaccine clinic in our pediatrics department. She jumped right into a clinical role as needed, as well as coordinating the RFT flu clinic for staff for the entire clinic with little to no resources identified. She never once complained and was always asking the question, what else can I do? This past year truly stretched the staff and providers at the clinic. The working conditions were challenging as we had to deal with a lack of staffing and hard to get supplies, but Natalia was always at work with a smile on her face. She never let the harsh working environment of healthcare during a pandemic affect her. She is the epitome of what Kaweah Care looks like and one of the best staff that I personally have had managing. Congratulations, Natalia. Thank you.
All right, I'm back. I'm Dr. Lori Winston, and it is my pleasure to announce the Kaweah Care Service Excellence Award from my department goes to Jessica Estevez in our Office of Research. Jessica has been with our department for just over 2 years, and during this time she's worked very hard not only to do the work of an administrative assistant, but also to acquire the knowledge and skills needed to act in the capacity of a clinical research coordinator. And in fact, she is now acting in this capacity. She has completed a nationally recognized program for this training and spent a significant time outside our office in the field, recruiting, consenting human research participants, and initiating non-invasive research procedures. She's training and supervising the work of volunteer research assistants. She's conducting regulatory visits from study sponsors and monitoring study protocol compliance. In addition, she's cross-trained to retrieve online journal articles and covers for our medical librarian, and she is coordinating operations in our institutional review board. She's an essential member of the Office of Research, and we would not enjoy the success that we do without her. So congratulations, Jessica, and thank you for all that you do. Okay, here we go. One more from me. So, it's my pleasure to also announce Kaweah's Inspirational Leadership Award from our department. This year goes to Crystal De Acevedo. I can't say enough good things about Crystal. She started way back when as our transitional year coordinator, and she's grown to be a true leader in the GME department. She serves as an invaluable coach, mentor, and member of the team. She expands the bandwidth of our team and has the knowledge, skills, and ability to help us continue to grow. I'm incredibly grateful for her hard work and dedication to our programs. Crystal always has something valuable to add when we are troubleshooting areas for improvement. Her ability to connect in a supportive way with staff, faculty, and residents allows her to gain invaluable perspective, and her subsequent assessments are spot on. Thank you for all that you do for GME, Crystal. This is well deserved. We appreciate you, and congratulations.
Good evening. It's a pleasure to be here and an honor to recognize these Service Excellence Awards. My name is Melinda Tupper, and I'm the Chief Financial Officer. First, I want to recognize Sonia Solis. Sonia Solis is a financial analyst, and she's part of our decision support team. You know, and when you walk into Sonia's office, it's very well decorated, but there's one thing missing. She's missing a hat rack, because she wears so many hats. And I'm not talking just about the ones that she wears for her official job, but she puts on all these other hats and is willing to do all these extra things. For example, before Sonia joined the finance department, she was a payroll specialist. So she knows all things payroll. And this last year, we had some staffing challenges in that area, in the payroll area, and it was all hands on deck. And Sonia worked so many hours and put in so much effort in making sure that that team stayed supported, all the while continuing with her regular job. Another example of her above and beyond service is her current role in leading the finances team activity committee. You know, I walked in the office, I think it was last Thursday, smelled great. And, you know, Sonia had put together a Cinco de Mayo luncheon for the team, and, you know, it was just so much fun, and everyone really enjoyed and participating in. And that's just one of so many things. I think you all get the idea of what I'm talking about Sonia. But there's one last thing I want to share about, and it's her manner in which she works with the leaders of the organization. As a financial analyst, she is responsible for helping the directors and leaders understand the differences in their budgets and variances and things like that. They're very complex. And she does it in such a wonderful manner and just spends so much time. She'll help with research, and it's so appreciated, I know, by all. So she genuinely, Kaweah cares, not just about the customers and the leaders, but also about her team. So, you know, Sonia, my hat is off to you in receiving this well-deserved award. Thank you. And next, I'd like to recognize Larissa Dotson. Larissa Dotson is that's right. Larissa is a senior financial analyst and part of the payroll team. Larissa, you know, honestly, she's just one of those people you want to clone. You want to have a bunch of Larissas, I promise you. In fact, you know, last year she was awarded the Hospital Service Award for the month of June. You know, everything she does with a smile, positivity, patience, and in a very professional manner. Just a wonderful role model to us all. She also will do whatever it takes to get the job done. For example, you all know that you can't mess around with payroll. You can't miss a pay date, although it would help my budget, I think. But, you know, what happened was during COVID in this last year, we really had some significant challenges in payroll, and not just with staffing shortages, but they had a whole slew of new processes and reporting that was required, and really kind of a double whammy. And Larissa demonstrated such a collaborative and supportive attitude and her willingness to work the extra hours to assist in figuring out new solutions, and she not only stays positive, but she brings laughter and encouragement to everyone on the team. So Larissa, thank you so much, and please let me know if you have a twin sister or anything else that would want a job. Okay, thank you.
Good evening. My name is Ben Cripps, and I'm the Chief Compliance and Risk Officer. And I'm honored to be here tonight to recognize two individuals from Kaweah Health's newest division. At this time, I'd like to welcome Laurie Irving, this year's winner of the Excellence in Service Award. Laurie has been a member of the Kaweah Health family for over 22 years, and for the last 12 years has served as a dedicated and well-trusted member of the Risk Management Department. Laurie is consistently professional, collaborative, and keenly focused on safety. She is empathetic, always going above and beyond to support, console, and bring comfort to those she serves. Daily, she guides others through unique and stressful situations with a calm and caring demeanor. On one occasion, a Kaweah Health employee contacted Laurie when a distraught patient stated that they were having thoughts of harming themselves. Laurie calmly and appropriately guided the employee through the steps to keep the patient on the telephone while another person called 911, while providing emotional support to the frightened employee. Laurie's peers describe her as simply amazing, the best, a star, and a once-in-a-lifetime employee. Laurie, thank you for your dedication and commitment to the Risk Management Department and all you do to provide world-class service. Okay, next I would like to welcome Evelyn McIntyre, this year's winner of the Inspirational Leader Award. Just over a year ago, I assumed executive leadership responsibility of the Risk Management Department. Immediately following this transition, leadership changes left the risk management team without a leader. Evelyn, through her deep commitment to the organization and this community, willingly assumed the role as the interim Director of Risk Management to fill a void during a difficult and challenging time. In the spring of 2021, Kaweah Health faced the most demanding regulatory survey in our history, which consequently resulted in the most exhaustive and comprehensive plan of correction to date. Through this process, Evelyn demonstrated leadership and commitment, working late nights to meet unrealistic demands established by the regulatory agencies. Evelyn has worked diligently to regain the organization's trust and confidence in the risk management program and has built a team of high-performing individuals who care deeply about our patients, our employees, and our community. Evelyn is patient, kind, compassionate, objective, and exhibits a quiet strength when addressing challenging situations and sensitive issues. Evelyn, thank you for dropping both of the interim titles in 2021 and for partnering with me to lead the highly effective risk management team. You are truly an inspiration and worthy of the title of Inspirational Leader.
All right, we're getting there, I promise. I am Mark Mertz, I'm the Chief Strategy Officer, and for my first award, I'm very pleased to present the Excellence in Service Award to Maria Rodriguez-Ornelas. Maria is a communications specialist in her media relations department. She joined Kaweah Health right at the start of the pandemic. She came to us from a career in television where she worked both on and off camera during live newscasts. So I don't know if it was perhaps this experience of working under the pressure of live TV, but she really hit the ground running at Kaweah. You've probably seen Maria performing on-screen interviews, doing live broadcasts at our various locations, and hosting live wellness chats both in English and Spanish. In fact, last year for this very event, she rebroadcast the Starlight Awards in Spanish. What you might not know, however, is that Maria produces many of the videos that you see on social media. These powerful videos tell the story of our organization and our team members. As a result, our social media engagement exceeds any organization in the Valley. Valley Children's Hospital actually has more followers than us, but we have nearly 5 times more engagements on social media. The one thing that Maria is truly passionate about is eliminating communication barriers for our community, particularly those that speak Spanish. Since joining Kaweah, she wasted no time becoming a certified Spanish interpreter. She created new Spanish language social media accounts, and she creates original content in Spanish. And her work has not gone unnoticed. We've actually received national attention, which saw Kaweah Health's content featured on Telemundo's national morning show, which is similar to the Today Show or Good Morning America. But perhaps as much as any of these accomplishments that I've mentioned, it's Maria's smile and her ability to put people at ease even when they have 3 cameras in their face that make her such an amazing and valued member of our team. So it's my pleasure to present Maria with this Excellence in Service Award. Very pleased to present my Inspirational Leader Award to Deborah Volosin. So if you're a Kaweah employee and you're ever really bored at work, take a look at the emailed org chart that HR sends out every month. Take a look at the directors that I have the fortunate, or I am fortunate rather, to work with on a regular day basis. You will see that my choice was difficult, but Deborah is extremely deserving of this award. Deborah oversees our community engagement department, which, including her, has a grand total of 1.5 FTEs. But you would never know this from the amount of work that they do, and it's an excellent reminder to all of us that you don't have to have a large team to be an exceptional leader. For those of you that don't know, community engagement oversees all of our community advisory councils and our ambassador groups. Every month, Deborah ensures that we are having meaningful conversations with dozens, if not hundreds, of community members. These conversations are about small topics like building a new hospital, patient experience, the future healthcare needs of our community, and employee engagement. These meetings not only allow us to update the community, but more importantly, to listen to them and to gain their insights. During the past year, Deborah's taken on new challenges, like organizing and hosting 20 stakeholder meetings where Gary got to update the community about our master facility plan. Since the start of the pandemic, Deborah has also served as our talk show host for more than 80 employee huddles and 70 community engagement webinars. This year, Deborah also launched the new Kaweah Helps program, which encourages our employees to give back to the community through service events. But perhaps what I most appreciate about Deborah is her can-do attitude and her integrity. She is willing to take on any challenge and does so with enthusiasm. When, not if, but when we pass our bond measure, it will have Deborah's fingerprints all over it. All of these qualities make Deborah an inspiration to all of us, and I'm pleased to present her with this award.
Good evening. My name is Ryan Gates. I'm the Chief Population Health Officer for Kaweah Health. I'd like to invite out Kelly Larson, my division's Service Excellence of the Year Award winner. I saw her back there. I knew she was there. So while we have many team members that live up to the criteria for this award, Kelly Larson is consistently exceptional. Kelly is exceptional not just in fulfilling her responsibilities of her job, but more importantly, for choosing a positive attitude on a daily basis. If you've had a chance to get to know Kelly, I hope that you someday will. I and the others that know her would say we are better people because of her influence over us. She's a woman of incredible internal strength and character. Kelly Larson consistently is observed living out the Kaweah Care culture wherever she finds herself. Kelly now works in the Population Health Division as a data analyst. She approaches every assignment with a sense of responsibility and ownership. She applies superb critical thinking to each project and consistently goes above and beyond to support her Kaweah Health teammates. With Kelly, one never doubts that her intentions are to be helpful and honest. These qualities make her someone that her team members and management can trust. She remains loyal to the organization and her department no matter what, always believing the best of others. I've seen her interactions with physicians, with managers or staff, and every time her manner is courteous, humble, positive, and respectful while imparting knowledge. Kelly came to us a few years ago with the experience and skills far beyond the job she came to do, but she committed herself to it with integrity and passion. She's a zest for learning, which contributes to her ability to do her very best. She first did this in the rural health clinics, supporting the clinic's administration in the very first application to the NCQA patient-centered medical home recognition, which was very successful, achieving level 2 status. She has continued to support the patient-centered medical home recognition and continues to develop as a subject matter expert on behalf of Kaweah. Kelly is deserving of the Starlight Award as recognition for her service as she represents Kaweah Care every day in her dedication to her work, her colleagues, and the organization. She wants Kaweah to be known as the best and will do her part to make sure the organization is a shining star. Thank you. Okay, our next award recipient for the Inspirational Leader Award, Crystal Clark. She is not able to join us tonight, but you see for her picture on the wall. And she has been with Kaweah for over 21 years, so clearly we broke some child labor laws back 20 years ago, I'm sure. Crystal is a true servant leader. As a supervisor, she shies away from being the center of attention. She also understands her team and gives credit where credit is due when reporting of improvements or accomplishments the team has contributed to. Under her direction, our population health data team have helped our organization accomplish incredible feats over the last few years. Having conducted over 100,000 chart reviews, mining for quality data, which has led to Kaweah Health earning over $80 million over the last 5 years in the Prime program. We look to the future with $60 million over the next 6 years for it transition to the Quality Incentive Program. The quality data that Crystal and her team have been able to obtain have also enabled our rural health clinics to rank #1 in quality in the state of California, according to Anthem, the Medi-Cal health plan. The list of achievements and awards and funds and recognitions that come to Kaweah are a direct result of their work, and I can go on and on. But Crystal leads her team by example She energizes the team around deadlines and infuses a sense of pride upon completion of these high priority projects for our system. Crystal does not shy away from the new programs. She fully embraces the fact that, quote, we fly the plane as we build it, and she is a committed partner in the process to meeting these goals. Crystal has an open door policy, and the work she and her team does requires constant and clear communication. Some of the shyest people work for her, and under her leadership have grown, learned to speak up, and even lead training sessions for her team. They have flourished and grown in their confidence and are now experts in their field. This can be attributed to her leadership. In the line of work she leads, data integrity is critical, and in the past reporting periods when errors have been identified, the team knows to stop the line, reach out to her, convene a huddle, and talk about the findings. At times, this has meant redoing hundreds, if not thousands, of chart reviews to ensure the proper reporting methodology is followed and findings are validated. Her team has learned not to shy away from speaking up when the alternative would be easiest, just to let it go. Crystal draws the best out of all of them. Thank you.
Good evening. I'm Jag Bath, your Chief Operating Officer. I'm honored to have two recipients in the Service Excellence of the Year category. The first, I'd like to invite Bao Vang up to the stage. Bao has been a pillar in our clinical lab for over 16 years as both a phlebotomist and a coordinator. Her excellence and consistency is at the highest level. This was never more evident than during the past year when the lab continued to severely be impacted by COVID in terms of high workloads and staffing challenges. Bao consistently and reliably worked long hours and frequently took extra duties without being asked. There were multiple instances where Bao would see coworkers struggling in her area that was short on resources, and she would immediately spring into action to fill the need. Bao is recognized often in lab throughput reports, highlighting her outstanding effort in multiple areas. With unparalleled dedication and versatility, it is no wonder that Bao is so widely admired and appreciated as someone who defines professionalism, patient-forward focus, and positive attitude that promotes teamwork, high morale, and service excellence. Bao's director, Randy Koka, describes Bao in the following manner: a true measure of an individual is shown on the impact in their absence. In regards to Bao, is undoubtedly one of the most valuable employees we have because we feel it when she is out. It reminds us that in her we have the best of both worlds, one of the most productive employees and one of the nicest people you will ever want to work with. In the area that is often overlooked or behind-the-scenes hero, Bao is richly deserving of this recognition for continued excellence. Now I'd like to invite Teresa Kinner, application analyst, up to the stage. I've had firsthand experience working directly with Teresa for a number of years, and talk about a person that consistently goes above and beyond her job responsibilities. Tiffany, who is the director over this entire division, and my biggest fear is that something catastrophic happens to Teresa, the entire home care division would come to a halt. Because what Teresa does for home care services is very unique. Her insights, in-depth knowledge, and experience with our entire application infrastructure, it would be difficult to replicate without Teresa being there. Teresa started her career at Kaweah as a medical records clerk in 1998, and now for over 20 years of experience as an application analyst. Teresa sets a high priority to learn and stays current and has completed a number of certifications to be a highly skilled application analyst. Teresa takes on additional tasks, again, not just related to her job description, to help home health, hospice, home infusion, and private home care in order to provide excellent service to our patients. Some of the additional tasks include hardware maintenance, application installations, and billing audits. Again, Teresa is indispensable in the entire home care division. She's reliable and handles chaos and stress that at times is pervasive in this position with ease and always with a good attitude. She will make herself available to staff at any time, day or night. The knowledge she has of this service line is mind-boggling. Even though Teresa is part of the ISS team, the home division sees her as an integral and key member of their team. Her exceptional willingness to assist, support the clinical staff is unmatched. Her outstanding service is held in high regards within the division, and we'd love to see her cloned. Her efforts and contributions are simply commended, and we are lucky to work with you, Teresa. Thank you. Now I'd like to invite up Renee Locke as one of our Inspirational Leader Award winners. Renee is the epitome of an inspirational leader. She has worked for Kaweah for 30 plus years as a leader within the imaging and radiation oncology services, first as an assistant director and now for several years as the director of a very complex and comprehensive service line, both inpatient and outpatient operation. She leads her team with passion, inspiration, and genuine care. She is known for her Friday Scoop departmental newsletter, what has set the standard on how communication needs to flow to frontline staff. Her departments have some of the highest employee engagement scores under Renee's leadership. Renee's managers and staff describe her as a leader who truly cares for employees and patients and regularly asks for their feedback and suggestions. She has a remarkable work ethic with a vast, in-depth knowledge of operationals. One of her many superpowers is her ability to know each and every contract and expiration date. She is an outside-the-box thinker who finds solutions to many problems. She is a mentor to many. She leads with grace and style, along with being a visionary who is detailed to the smallest of details. Renee, you are one of the most respected leaders here at the organization, and it is an honor for me to work with you. Congratulations. Now I'd like to invite Debbie Salazar as another one of the Inspirational Leader of the Year winners. Debbie, this past year, has gone above and beyond her job responsibilities in hospice. When we decided to partner with the Hospice Foundation and open the Open Arms House, you were the first one to jump on board. She completed rigorous training that we needed immediately. Beyond that, you've implemented major operational changes around staff productivity and scheduling. You lead your team. You had led your team through some difficult transitions by offering support, answering all their questions, and keeping a very positive outlook from the very get-go. Those changes have led to phenomenal financial success with our hospice program. From quality to outcomes to patient and family engagement perspective, our hospice sets the bar in the area under your leadership. Tiffany and the department describe you as a leader who is extremely dedicated to her team, supporting her team by stepping in and treating necessary and working extra hours to perform her own management duties with patient care. Debbie is a stellar hospice nurse who always puts patients' needs first. Debbie sees the bigger picture. She balances the needs of her staff, the patients, and the district as a whole when making decisions. She is trusted and has the best interests of her employees in mind. She's extremely reliable with a down-to-earth personality with just the right amount of sense of humor. Debbie, you are a manager who has such desire to learn and be a better leader who does not shy away from challenging situations. Tiffany and I are extremely lucky to work with somebody of your caliber and truly believe we cannot have a better leader that runs our hospice program than you. Congratulations.
Thank you, Deborah. Okay, where am I? I am not Carrie Nowesky. I introduced myself earlier. So Carrie, our Chief Nursing Officer, unfortunately was not able to join us this evening, but I know she really wanted to be here. I forgot to mention earlier that this is National Nurses Week, where we've had a lot of fun this week expressing our gratitude and our appreciation to our amazing nurses, their compassion, their care, their selflessness, and you've got a sense of that this evening as some of our nurse award recipients. You got to hear about just the amazing care that they provide to our community. So I am very honored to be handing out Carrie's awards, and Carrie's first award recipient for excellence in service, quality, and patient safety is Melissa Pinero. If you look back over the last several years and check behind the scenes where the war room decisions were made, you will see Melissa there neck deep in the action. Melissa is an RN on our infection prevention team. The depth of her knowledge, the commitment to her expertise, and the devotion to our patients and our staff saves lives. Melissa is an expert in infection prevention and is an integral part of the clinical leadership decision-making in our post-acute and mental health environments of care. Melissa is responsible for the health and well-being related to infection prevention for all of the skilled nursing, rehabilitation, and mental health patients in our organization. The teams could not succeed without her. Melissa went above and beyond, becoming an expert on the rules and regulations for patient care and employee health in the mental health and post-acute areas. She was always available for any question, made herself available for meetings, and always had a plan. She jumped right onto a 2-hour phone call on Christmas Day, 2020, when mental health experienced their first outbreak, and she has not let up yet. She is driven to create a safe environment for our patients while educating the caregivers around her. Melissa's innovation, problem solving, and meticulous approach to infection prevention has left its mark. She is a teacher and a caregiver. Melissa has made it possible for us to deliver care in the safest of manners. Thank you, Melissa, and congratulations. Carrie's next award recipient for excellence in service for patient care is Sonia Fajardo. Sonia is a certified nurse assistant on 4 North, our inpatient dialysis and renal unit. Sonia is recognized for her commitment to patients, her team, and Kaweah Health. She sees the good in situations and brings out the best in others. She breaks down fears and helps new team members feel comfortable in their roles. Sonia teaches her team how giving to others is a reward. She models going above and beyond, then shares the joy she finds in that action with others. She gives of herself and she motivates others to join in. She is an advocate for patients and the team. She is always present and ahead of the needs of patients and the team. When she is taking care of a larger than normal patient assignment, she thanks and commends her teammates for the support. Her team and her leaders all say the same thing. Sonia has a natural ability to connect with people in an instant. Sonia brings out the best in all of us. Congratulations and thank you, Sonia. It's good to be up on the stage with you again. Thank you. Carrie's next award recipient for excellence in service for patient care is Julie Arciaga Tuvera. Julie is a labor and delivery nurse. She is extremely dedicated, professional, kind, caring, and a wonderful person and nurse. She is an experienced clinician on the team and a resource for everyone. She is often in the role of mentor and preceptor due to her nurturing approach to helping others develop and learn. People gravitate toward her. She exudes kindness and sincerity. Julie is an extremely talented teacher. She has mentored many nurses. She takes such pride in the people she precepts and mentors. Her determination and perseverance in all things is remarkable. She is an incredible teammate and is a unit leader through her involvement in the unit-based council and shared decision-making. One of her missions is to celebrate and recognize everyone on the team. Julie exemplifies nursing through her passion and compassion. She is one of the reasons we are world-class in this organization. Julie, thank you and congratulations. I'm doing this wrong, huh? Thank you, Julie. And Carrie's next award recipient for Inspiration Leader for Patient Care is Rebecca Pichet. Becca is an inspirational leader because she is committed to each employee. Becca goes above and beyond to help her team feel comfortable and connected. She assisted in starting a 4 North hiking club called Forward North to help her team feel connected and take a break from their stressful jobs, especially during COVID. She started the Big Bird program to help new hires feel more connected to more people on the team. Other patient care departments are now using this program. Becca is always thinking of fun ways to make work special. She arranges recognitions and appreciations for her preceptors, her charge nurses, and her teams throughout the year. She is creative and thoughtful, using compassion and a genuine appreciation to let others know how much they are valued. Becca has nonstop passion to create the best place to work for her team and to create a highly skilled environment for patient care. Congratulations, Becca. We would not be successful without you. Carrie's next award recipient for Inspirational Leader in Quality and Patient Safety is Maribel Aguilar. Maribel leads our safety team for the organization. She has extensive responsibility for the environmental safety and oversight of various patient care settings. Her team is a committed team, and she provides them with structure and autonomy to do their jobs. She provides an avenue for her team members to build a safer workplace for our healthcare professionals through education and interventional development. Maribel is an expert in safety and regulations. Her knowledge is key to the success of our organization, maintaining a safe environment in all buildings. She embraces her role and inspires her team members to work with the same passion and commitment. Over the last several years, Maribel has led the team with the highest employee engagement scores. She creates an environment where her team can speak up, share ideas, and take ownership. She encourages people, gives them the tools they need to do their jobs, and then helps them push forward. She is a strong leader who is trusted, and she is a good friend others rely on for knowledge and support. Maribel drives changes through relentless commitment to the mission of our organization. She has a passion for healthcare and strives towards excellence for herself, her team, and the organization. Thank you, Maribel, and congratulations. Thank you, Maribel. And Carrie's final award recipient for Inspiration Leader for Patient Care is Andrea Hodgkins. Andrea is respectful and professional. She truly cares about her team and expends a lot of energy, both at work and on her personal time, to do things to celebrate and recognize them. This last year has been a hard one for the 3 North team, as the unit went back and forth between COVID and non-COVID several times. Each time the unit had to flip populations, Andrea was leading the charge, helping the team adjust. Some new staff had only ever been hired during COVID and now had to learn post-op care. For other new staff, it was the reverse. Knowing how hard these transitions are on the team, Andrea gets ahead of it with education, resources, and expertise, but mostly by simply understanding and being present for the team, giving of herself. She is a servant to her team and leads by example. Andrea continually challenges herself. She consumes knowledge and opportunities to grow. She has an amazing intuition for what her team needs because she understands them. She is an inspiration as a leader and as a nurse. Congratulations and thank you, Andrea. All right, a fan club. All right. Thank you. I also have the distinct pleasure and honor to hand out the 2 awards for Diane Cox, our Chief Human Resources Officer, who was also not able to be here tonight. But this is a real delight for me because these are 2 of my favorite people at Kaweah Health. But like my children, I care exactly the same for both of them. Yes. All right. So Diane's first award recipient for Service Excellent Leader of the Year is Valerie Lee. During Val's 37 years with Human Resources at Kaweah Health, we would guess that she has welcomed around 25,000 people to our organization. Val continually amazes that she can recall not only the names of many, but also something about each of them. We hear this often from people who visit us. Val leaves such a positive impression for no other reason than she cares about Kaweah Health and the people who work here. Val's duties are many, and she is always positive to change or take on something new. Val is quick with a nice word or a written compliment to members of the Human Resources Department. I suspect she does the same with others outside of HR as well. When I read the essential criteria for this award, it's Val. She demonstrates special acts of kindness, including bringing staff flowers from her garden. She is so kind. Val goes above and beyond, is always positive, exudes professionalism, and is a role model for all. Diane is sorry she isn't here to present this award tonight to you, but she extends her deepest appreciation and gratitude to you, Val, and thanks you for all you do and who you are. Thank you, Val. Diane's next award recipient for Inspirational Leader of the Year is Raylene Lares. Diane sends her apology for not being here tonight for the awards, but asked me to share the following words about Raylene. Raylene Lares has worked with Kaweah Health for 22 years, nearly all in the area of employee relations and now engagement and organizational development. Raylene works on behalf of leaders and staff to uphold and promote the ideal work environment. She is a teacher, mentor, counselor, and supporter as she guides leaders and employees alike. As a testament to her impact in the organization, after my nomination, Raylene received this Kaweah Care recognition from a new leader at Kaweah Health. It refers to a weekly class that she has provided to all leaders on building and maintaining employee relationships at work. It reads, "I just want to say a big thank you to Raylene for such an awesome employee relations class this morning. By simply highlighting our behavioral standards of performance and focusing on the why of what we do, it really drove home the reasons I am proud to work here at Kaweah Health. I will continue to utilize the valuable tools that were discussed during this course and work on improving the culture and being a positive influence for my team. I wanted to express my appreciation for Raylene's genuine commitment to colleagues, her unwavering guidance, and how she is inspiring confidence in a new leader." Raylene's expanded role now includes focusing on leadership development through advanced education and programs. She is also responsible for the employee engagement survey process, as well as our newer Pulse life cycle surveys, which focus on exit interviews, onboarding checkpoints, and stay surveys. Raylene is a role model of Kaweah Care, and she cares deeply about Kaweah Health and all leaders and employees. She is an inspiration to all of us. Thank you and congratulations, Raylene. Thank you, Raylene. Okay, now it is my turn with the last two leadership awards of the evening. And my first leadership award for excellence in service is Mark Mertz. Mark is our Chief Strategy Officer, and in just a couple of months, Mark Mertz will mark his 4-year service anniversary with Kaweah Health. But I can't think of another person who has made more of an impact on our organization in such a short period of time as Mark. In fact, one of Mark's first accomplishments was to help create our new mission and vision statement and to transform our 4 goals into our 5 foundational pillars. Everywhere you go throughout Kaweah Health, you now see those words. Health is our passion, excellence is our focus, compassion is our promise. If that wasn't enough, our Chief Strategy Officer helped transform our brand and identity to Kaweah Health after 60 years of being known as Kaweah Delta. Fresh, colorful, and modern, our new look and logo has injected new energy and life into us. I can't begin to fully cover Mark's lengthy list of accomplishments in the areas of service development, market expansion, physician recruitment, facility and technology acquisition, development and advancement, marketing and public relations, strategic planning and development, and so many more. Mark, thank you for everything you do to make Kaweah Health a better organization and a world-class destination for care. Thank you, Mark. And my final award recipient, our Kaweah Health Inspirational Leader Award recipient, is Melinda Tupper. Our very funny Chief Financial Officer. Yes. So, similar to Mark, Melinda is also one of the newer members of our executive team, having just celebrated her 5-year service anniversary with Kaweah Health. Chief financial officers may not be top of mind when somebody thinks about an inspirational leader, but then again, they have not met Melinda Tupper. Over the past 2 years, I cannot imagine how we would have survived if not for Melinda's creativity, ingenuity, cleverness, perseverance, fortitude, and inspiration. When revenues began to plummet and expenses began to soar, we all began to worry, including Melinda. But Melinda did not allow fear to dampen her spirit. Rather, she chose to double down on keeping us positive and optimistic. Through her hard work and determination, Melinda made sure that Kaweah Health remained financially strong and capable, as most recently evidenced by Moody's Investor Services affirmation of our A3 credit rating. I am deeply grateful to Melinda for her financial leadership, and I am inspired by her support of our future. Congratulations. Thank you, Melinda. Okay, I'm going to get back on track here. We're coming down to the wire. Okay, before I announce our Employee of the Year, I would like to take a moment to honor and remember those dear Kaweah Health family members we lost this last year. Deborah Ballesteros, a registered nurse, a charge nurse on our skilled nursing and transitional care services unit with 17 years of service with Kaweah Health. Angela Westlake, a physician assistant in emergency medicine, 3 years with Kaweah Health. Dr. Benjamin Brennan, a family medicine physician with the Kaweah Health Medical Group, who we lost after 7 years with Kaweah Health. And Valerie Aguilera, a patient accounting clerk in our mailroom for 5 years of service. So please join me in bowing our heads as we honor these fallen Kaweah Health family members with a moment of silence. Thank you. Okay, so one more thing before I announce our 2022 Employee of the Year. I would like to offer a very special thank you, an expression of appreciation to our Starlight Awards Committee who made this wonderful evening happen. There were, yes. I can't begin to tell you probably how many hours they put into making this such a well-coordinated and enjoyable evening. We've been doing this for a number of years now, and I have to say that they far surpassed the execution of this event tonight. So thank you to our chairperson, Kelsey Davis, Rosie Gonzalez, Tina Lockwood, Raina McNamara, and Michelle Adams. And a special word of thanks to Carrie Knudsen and Deborah Volleson for creating and coordinating tonight's program. And Allison, sorry. Allison. I should never forget Allison. Yes. Okay, we've arrived at the big moment. So in 2019, at the inaugural Starlight Awards event here at the Fox Theater, we honored Emma Camarena, our very first Employee of the Year. And then in 2020, we did something entirely different, but appropriately different. We were in the midst of COVID, and every single one of our more than 5,000 employees stepped up and just provided heroic care to our patients, our community, and to each other. So for that year, we actually recognized the entire Kaweah Health organization as our Employee of the Year. In 2021, we honored Molly Niederreiter as our Employee of the Year. So in the past, I think we've done a pretty good job keeping it a secret from our Employee of the Year. But in years past, as I would read the nomination of this person, I would try to keep everybody in suspense and not mention any pronouns or really, things that would tip you off in terms of who this person might be. And while that did make for a lot of fun, I think it maybe takes away a little bit from our enjoyment. And so I am going to announce the name of our Employee of the Year and ask this person to come up and stand by me while I read his nomination. So our 2022 Employee of the Year is Mark Wilson. Mark, we definitely lured you here under false pretenses, but we're so glad that you came because it's going to be fun reading your nomination. It's quite moving and inspirational.
Is there an AED close by?
You'll do fine.
Okay.
You'll do fine. After I read this, you will all absolutely agree unanimously that Mark is every bit one of Kaweah Health's most outstanding employees and absolutely deserving to be named our Employee of the Year. Mark Wilson works tirelessly to provide world-class care to everyone he meets throughout Kaweah Health, whether it is by providing compassionate and excellent care to patients and families or to the staff that he's encouraging. Several years ago, Mark was in a terrible biking accident that could have killed him. He persevered through months of intense physical and cognitive therapy to emerge with a new determination and renewed passion for serving. He has a true servant's heart and lives it out each day. He balances being a full-time pastor at Sierra Baptist Church in Visalia, a family man supporting his children and grandchildren, and a full-time chaplain at Kaweah Health. Mark is a lifelong learner. He earned his bachelor's degree from California Baptist University, a master's in divinity from Golden Gate Baptist Theological Seminary. He is about to test for his proficiency in Latin exam and is a PhD candidate at Midwestern Seminary in Kansas City. Mark provides outstanding care and services. During his career at Kaweah Health, he has served many locations of the district, including our West Campus and throughout the main campus. He was recognized as the Ancillary Employee of the Quarter a while back. During each surge of the COVID-19 pandemic, Mark has been at the bedside of innumerable patients. He has successfully navigated the many, many changes related to visitors. Outside of our respiratory therapists, Mark has been with more patient deaths than almost anyone else here at Kaweah Health. He was an integral part of an after-hours memorial event organized by Dr. Marks for the ICU residents during the height of the Delta variant surge. He truly loves serving people and will jump in to fill any need he sees. Mark's home base is the emergency department, where he is known for his Mark Mints. He has given out more than 4,000 mints to the team and is known for his question, "Have you smelled your breath inside your mask after 8 hours?" On top of his strong theological background, his medical experience as an EMT blends well in his role. He committed to 10-hour shifts and has been key to seeing inroads to building resilience encouraging staff and being a constant and consistent presence, especially for the weekend and evening teams. Mark's leadership has inspired and set a high bar for quality and competent chaplaincy. Mark advocates for improvements whenever he sees something not working correctly. He is always willing to speak up if he sees an opportunity for enhancing the experience of our patients and families. He advocated for the Chaplain Services Program to underwrite the fingerprint heart rhythm strips for patient families. Chaplain Mark is a role model for so many of us by providing a model of consistency, commitment, and loyalty. Thank you, Mark, for everything you do to support our patients, our community, and each other. You inspire us and make us very proud to call you friend and colleague. Congratulations on being named our 2022 Kaweah Health Employee of the Year. We're not certain what quite to say about this trophy. We thought that if you were to take it home, there's probably no place you could appropriately display it in your house or your office. I know it looks more like a bowling trophy than Employee of the Year award, but we wanted to be able to take some photographs, like right now. But our intention is to turn it in to an annual award, kind of like what's the cup of the British Open?
Ryder Cup?
Something like that. But we'll mount the names of all of our different award recipients. So, Mark, thank you so much. But I want you to stay up here because we have a number of things that we want to recognize you with. Now here's the real one that I think is much more elegant and would look more appropriately displayed. All right. So, in addition to our admiration and our praise and our gratitude of your incredible service to our community and our organization, we have a few gifts to present to you. Starting with a $500 Downtown Visalia gift certificate. $40 hours of paid time off. Ooh. Somebody might wrestle you for that one. A reserved parking space for 1 year. It doesn't get any better than that.
Is it a motorcycle?
Is that what you ride? Okay. A certificate of recognition from Kaweah Health. And I'd like to invite up to the stage Tulare County Board Supervisor Amy Sheklian.
This could be trouble. No trouble.
So Amy is presenting you with a certificate of recognition on behalf of the Tulare County Board of Supervisors.
I am?
Yes, you are. And you wanted
Can
to say that, huh?
To say something?
Absolutely.
There's no mic. Oh, there is a microphone.
When do you need a microphone?
Not often. Not often. You know, I just want to say I get a lot of certificates come across my desk for signature. And this one came a couple of weeks ago, and I looked at it and it says, I need to be there to present this to Mark in person. I worked at rehab for 17 years, and I was it's not a HIPAA violation anymore because we already talked about it, when Mark was a patient there when he had his accident. And he is an incredible man, so dynamic. He never was down on himself or pitied himself. He used humor to get through his situation, which of course I always appreciated. And once he was done with his rehab, he came back. He volunteered his time because, I hope this has changed, but rehab really didn't have a regular rotation of chaplains coming through. And so Mark took it upon himself to come and visit patients who were at times in the same situation that he was in. So I couldn't miss being here tonight to give you this recognition, Mark. Thank you.
Now, on behalf of the Visalia City Council, I'd like to invite up Councilwoman Liz Wynn. Liz, you probably want the mic too.
Oh,
huh?
yeah.
Yes. I tell you, these politicians, you give them a mic.
And this is family. This is family. When I saw this come across the council, I was so excited. I said, no, I'll do this one. So, Mark, congratulations. In recognition of being Kaweah Health's 2021 Employee of the Year, the Visalia City Council congratulates you on this high honor and acknowledges the amazing care you give to your fellow employees, the patients, and families in our community. Thank you so much on behalf of Visalia City Council.
Thank you, Liz. So we also have another certificate of recognition from the California State Senate on behalf of our State Senator Shannon Grove, who was not able to be here this evening, but she also sends her gratitude and appreciation and congratulations to you, Mark. And you have that certificate, I think? Yes. So it reads, on behalf of the California State Senate, it is my pleasure to recognize Mark Wilson, chaplain, in honor of being selected as Kaweah Health Employee of the Year. Congratulations on being chosen as the Kaweah Health Employee of the Year. Your commitment to strengthening the spiritual care for patients and visitors has had a meaningful impact at Kaweah Health and in our community. Please accept my sincere gratitude and best wishes for your continued success. Shannon Grove, Senator of the 16th District. And we're having Deborah hold all of your awards. And okay, a couple other things. Mark, have you ever, you've walked many times through the Mineral King wing entrance and see those beautiful light boxes with the portraits of our world-class employees of the month. I don't know if you ever saw yourself being in that box, but that's where you're going. So we are actually going to have a professional photo taken of you by Roy down at Roy's Photography on Main Street, and it's going to be a delight to display you in that so everybody can come by and high-five you and congratulate you. And then lastly, in the hallway of the Kaweah wing, we have the Employee of the Year plaque. And so your name will be emblazoned right below Molly Niederreiter. And again, people stop in that hallway, visitors, families, employees, and just for them to be able to see what a wonderful person you are. And it just, what a great evening. What a way to punctuate the evening with such a special person. And obviously, people care so deeply about you, Mark, and we're just so proud and happy. Thank you.
God be the glory. I'm still in shock. I don't know what to think. So.
I know. When I saw you at the table there, too, outside, and I just welled up in me thinking about what was going to happen later that evening. So thank you, Mark. Okay, folks, we didn't quite stick the landing. We had targeted, maybe we were a little bit ambitious, but I would just like to say on behalf of the board of directors that we're here tonight, and thank you for being here, on behalf of our entire executive team, thank you all for your passion for health, your focus on excellence, and your promise of compassion. So have a good night and a wonderful evening.